Okay, we'll get started here. Let's start cardiovascular. Starting with the heart. The heart, chapter 18. The heart is a part of the cardiovascular system, which actually comprises of three parts. Now, the cardiovascular system is also known as the circulatory system. Blood circulates, it goes round and round. I use those terms interchangeably, means the same thing. The system includes the heart, which we'll study. Heart is chapter 18. And it's its own test. And we'll think of it as the muscular pump that pumps blood. Arterial blood won't flow by itself. The heart generates pressure to push it forward. Muscular pump. That generates pressure push blood forward into arteries. I said this before, arteries, they take blood away from the heart. And kind of the next component of the circulatory system. So the vasculature. The vasculature is another chapter, I think it's chapter 19. And basically the blood vessels. The blood vessels, a vessel carries something. These basically are vessels of blood. The blood, I don't know, it's kind of an obvious explanation of blood vessels. And blood is always flowing, okay? And the crucial thing that we like to measure is blood pressure, BP. And we always express it as two numbers. Well, not always. You can express it as one number. But usually, if you take a patient's blood pressure, BP cuff around the arm, you present it as two numbers. And the reason is, the top number representing something called systole, systolic BP. Now, this is related to the heart. If the heart is in systole, the heart is in a state of contraction. That's when it's doing the pushing. It's pushing the blood forward. And that causes the high number in your two numbers of blood pressure. The pressure when the heart's in systole, systolic blood pressure. But then there's a pressure drop. That's called diastolic blood pressure. That's the pressure in the blood vessels when the heart muscle is relaxed and filling with blood. Diastole for the heart, think of it as relaxation or filling time. Filling with what? Blood. If the heart's going to pump blood, it must first fill with blood. So with each heartbeat, there's a period of relaxation and contraction. And okay, well, anyways, blood vessels carry the blood, and you can measure the pressure. If there's a high enough pressure, there's going to be plenty of blood flow to the capillaries. And the whole purpose is to circulate blood, life-giving blood. The red blood cells have hemoglobin, which I abbreviate HB, that binds oxygen. And I usually abbreviate that HbO2 for oxyhemoglobin. Well, anyways, I think it's chapter 17, and it's its own test. So each of these is its own test. We're just doing the heart, but it's good to mention all three things together to introduce the system. And so I want to start off with teaching students how blood circulates. And there's this figure. Okay, I'm going to put a number 1 here. That's where I want to start. It shows you the heart. And one of the things we learned is that there's 2 hearts. There's a right heart and a left heart. And the other thing we see is there's 4 chambers in those 2 hearts. And when you talk about a circuit, it doesn't matter where you begin, because you'll end up where you started. I usually like to start with the number 1. And that chamber of the heart is the right heart. Specifically, it's the right atrium. So why put the number 1? RA, short for right atrium. Now look at the heart. As you look at it, it's on your left side, but it's always the patient's perspective, correct? That's why it's the right atrium. Okay. Now the atrium, there's a left one too. Basically, these are receiving chambers. They receive blood, and the right atrium receives the deoxygenated blood from the whole body. Right atrium. That's kind of what's illustrated there. You can see all the blue blood being returned to that one chamber. If blood is deoxygenated, it's the job of the right heart to pump it to the lungs to get oxygen. So from number 1, blood flows from the right atrium on forward to number 2 right here. This chamber is the right ventricle of the right heart. Call it RV. Right ventricle. Well, the ventricles are the pumping chambers. So when the ventricles fill with blood, they pump when they generate pressure. And so right ventricle will pump blood into the pulmonary arteries. I'll just kind of point to the pulmonary arteries. Arteries take blood away from the heart. So the pulmonary arteries are on their way up to the lungs. Okay? Pulmonary arteries. And I'll use blue because they carry deoxygenated blood. Pulmonary arteries carry deoxygenated blood to the lungs, specifically to the pulmonary capillaries. It's the pulmonary capillaries where you get gas exchange at the lung. And people know this, you breathe fresh air to your lungs. That's why you can have exchange. Basically, gases are just flowing down the concentration gradients. And if your lungs are ventilated with fresh air, oxygen will enter the blood. Okay? Because blood coming in is deoxygenated. So, pulmonary capillaries. Let me draw pulmonary capillaries, half blue, half red here. To symbolize the fact that the blood picks up O2, becomes oxygenated. And that's great. That was the function of those pulmonary arteries and capillaries, to pick up to oxygenate the blood. So blood can circulate now oxygenated. So you need a collection system to collect this freshly oxygenated blood, and you need to return it to the left heart. And that's the job of the pulmonary veins. Drawn in red. They return oxygenated blood from the lungs to the left atrium. There's 4 of them. Return oxygenated blood from lungs to left atrium. So let me put a number 3 there, where the left atrium is. There's a 3. LA for left atrium. I'll just kind of restate what I just said. The left atrium, it's receiving oxygenated blood from 4 pulmonary veins. 2 are on the right, 2 are on the left. Receives oxygenated blood from 4 pulmonary veins. So I put the number 3 in the heart. Now we're on the left side of the heart. It's the job of the left heart to pump oxygenated blood to the whole body. So blood goes from the left atrium to the left ventricle. Put number 4 there. All right? That's the 4th chamber, the left ventricle. LV, left ventricle. Pumps oxygenated blood to systemic capillary veins. That's that man on the bottom. I'll just say systemic capillaries. And, those are basically capillaries of the whole body, and the left ventricle has a very important job of doing that. I mean, the right ventricle has a much easier job. It's just pumping blood to the lungs. And the lungs are filled with air. And there's not a lot of resistance to kind of get the blood there, but for the left ventricle, usually your systemic capillaries are fluid-filled spaces, and it's harder to pump against that. The left ventricle has to generate more pressure than the right, although their output is equal. They pump blood and goes out quite easily. Now, so systemic arteries will then deliver oxygenated blood to the whole body. Okay. So I kind of skipped this step. Okay, eventually you want to get to the systemic capillaries, but let's call these vessels systemic arteries so you don't confuse it with pulmonary arteries. So let me write that term up here. I'm going to erase the top. So I'm going to use systemic arteries. I'm going to color it red. What does red mean? The blood is oxygenated. Systemic arteries carry blood, basically away from the heart to systemic capillaries. Carry oxygenated blood to systemic capillaries. When blood gets to the systemic capillaries, again, you have gas exchange. Now blood will kind of drop off the O2. O2 is just flowing down this concentration gradient. I'll draw systemic capillaries, half red, half blue. I'll just say drop off O2. It's the job of the systemic veins to collect this spent blood and return it to the heart. Collect deoxygenated blood. Return it to RA, where we started. One, two, three, four. So we're back to where we started. And if you're following, we did a double loop. We went through the pulmonary circuit, that's one loop. And then we did the systemic circuit, that's another loop. It's pretty basic. Start off with, I call this number one, right atrium. Number two, right ventricle. Pulmonary arteries, take blood away from the heart, arteries away. You force blood to percolate through pulmonary capillaries. Blood picks up O2, and then the pulmonary veins carry oxygenated blood back to number three. What chamber is that? LA. Yeah, left atrium. From there you go to number four, left ventricle. Systemic arteries carry that blood away, arteries away, right? You force the blood through the systemic capillaries, and basically the systemic veins will collect all that blood and return to where you started. Okay, so that's the double loop. That's how blood circulates through the pulmonary circuit and then the systemic circuit. And just remember, veins in. There's an in veins. Veins return blood to the heart. Arteries take blood away from the heart. Now that rule is always true. Okay. So here's a picture from the slides, and what I did was I put your coloring book picture right next to it, so we can kind of color in some of the major structures. We have a heart dissection on Monday, and you want to make sure you're dressed appropriately for lab. And the sheet part, and I'm trying to find a good video to watch to give you a preview. I would like you, well, there's different ways you can do it. I haven't quite decided yet. One way you can do it is you can cut the heart right in half, but in the frontal plane, in the coronal plane, so you can see the internal structures. Okay. There's some things here I haven't mentioned yet.
Is our quiz going to be before that, or are you going to do it after?
You'll have an anatomy quiz on Monday at the start of class. And the sheet part dissection will just be during the normal lab time after I'm done lecturing. So you do need gloves and goggles for the dissection. They're fresh, and so they're liquidy. There's a lot of fluids, and you'll be making incisions and cutting, and you want to make sure your eyes are protected. So here's the heart with the internal structures, so you can view it. Let's start with what you know, the four chambers of the heart. So this chamber, I'm going to trace it. What chamber is that? I called it number one. RA. Yeah. Right atrium. Okay, it's going to receive blood. There are two main veins that basically drain blood from the whole upper part of your body and lower part of the body. They are the superior and inferior vena cava. So the superior vena cava, superior means from above. So there's an arrow here. It's bringing blood to this vessel here. That's pretty much the SVC, the superior vena cava. and the other one is the inferior vena cava. Now I'm using blue because it symbolizes the deoxygenated blood. So on this picture, it's right there. There's a little blue arrow down there. Blood is going up, and here's the inferior vena cava right there on this. Okay, IVC. And there it is there. And you can see it on the picture that's right next to it too. So there's a third structure that dumps blood into the RA. So the right atrium receives blood from dot dot 1 superior vena cava 2 inferior vena cava 3 coronary sinus. Now the coronary sinus is a vein. We call it a sinus, and it's draining blood from the entire heart muscle, the myocardium. Drains blood from myocardium to RA, right atrium. So that's a third thing. You can kind of see it in there. On the coloring book, they put a little orifice right there. And they label it coronary sinus right there if you're looking at a coloring book. You can't see it because it's on the back, but you can kind of see the orifice where it drains into the structure. Okay. So those three things. And that's blood from everywhere, going right to one chamber, the right atrium. Now, there's another structure in there that's labeled on the coloring book. You can kind of see it there on the picture. Here it is right here. It's a depression. Kind of color it in there. I'm going to label this fossa ovalis. Now, it's not a blood structure thing, okay? It's just a depression. Okay, so I'll kind of put it in parentheses. It's not draining blood to the right atrium, but it's present in the right atrium. And it's a depression. It's a remnant of fetal circulation, which I'll teach later. I'm not using it anymore, but you can still see that it was there. A remnant of fetal circulation. Just to kind of give you a preview of fetal circulation. In fetal circulation, blood travels differently. In fetal circulation, the baby's not even breathing. And so the lungs are filled with like fluid. And so the pressure changes are different for the right heart. It turns out in fetal circulation, blood can flow from the right atrium directly to the left atrium through that valve. The fossa ovalis is more like a valve in fetal circulation. Straight from here to there, and therefore you bypass the lungs because you're not really using them because baby's not breathing. But notice when I taught the adult circulation, go back a slide, and I want to make this point. I tend to ask it on tests and quizzes a lot. The question would be, true, false? The only way to get from right heart to left heart is through the pulmonary capillaries. True or false?
False.
No, that's true.
Oh.
The blood doesn't go from there to there. It goes right through in the adult.
Oh, in the adult.
In the adult. And now, in fetal circulation, I'm saying fossa ovalis is there. I want you to identify it. But in the baby, not in the adult, blood can flow from there to there.
That's true.
Yeah, that's true. So, I want you to be able to identify fossa ovalis as an anatomical structure. Okay, and let's move on from right atrium to right ventricle. Now the right ventricle, has an odd shape. I'm going to trace all where I think it is. There's this lighter blue, goes all the way up there. Trace all around the right ventricle there. Okay, so why are you tracing this light blue, I hope you can see it. I trace the confines of RV, right ventricle. Well, let me draw it in black. Right in black, right ventricle. And I use this light blue color to... Can you see that light blue in the back at all? Well, basically, could you identify that chamber?
Yeah.
Okay, identify chamber. Right ventricle. What is that one? Right atrium. Yeah, so they're kind of right there. And I didn't color it in because there's structures here I want you to see. But that is a big chamber to fill with blood. Its job is to fill with blood and pump deoxygenated blood to the lungs. Now, there's a special part of the right ventricle that the left ventricle doesn't have. You see how it kind of like, blood is going to like flow. Let me show you over here. Blood has to kind of flow forward, like from there to there. And it's a U-turn and goes up like that. So the blood flow track, it's called the outflow track. You have to like take a U-turn. Now the part of the right ventricle after you take that U-turn, where the ventricle, it kind of cones, like this area here. I'm going to color it in solid. So where I colored it in, where it kind of funnels, that's called the conus arteriosus. Note the conus arteriosus. It's a structure of the right ventricle. It's not in the left. It's the part where it kind of funnels up. Okay, there's a valve inside the heart between RA, RV. Okay. The purpose of valves in general is to prevent backwards flow of blood. Okay? And the name of the valve between RA and RV, I typically call it the tricuspid valve. The tricuspid valve has how many cusps? What do you think tri refers to?
Three.
Three cusps. It's typically, you can also call it, because it's on the right heart, you can call it the right atrioventricular valve. That's another acceptable alternative, longer name. Right atrioventricular valve. So right AV valve, tricuspid valve, same things. I'm going to color the cusps. Well, how about orange? They're right here on the coloring plate. There's three of them. There's one. There's another one. There's another one. So I'm coloring the three cusps. Okay, so I just colored the cusps. You know, it turns out the AV valves, they're controlled by these tendons and muscles that help keep it closed during systole. Okay. Now, the way they're drawn open. This is how they are when when the heart fills with blood, when the ventricles fill with blood. These valves must be open. But anyways, there's these little heartstrings. What color should I use? They're right here. I'm going to use this kind of purplish color. Chordae tendineae. Chordae tendineae. So you got the cusp, you got the chordae tendineae. Just call them the heartstrings. Well, that's how I'll describe them. You need to call them chordae tendineae. And when you see them on your heart on Monday, you can pluck them. They're really tough. They're very white, even though I colored them this purplish color. Anyways, distinguish between the cusp and the cord. And also, there's a muscle that the tendon attaches to. It's called the papillary muscle. Color it in. Nipple-shaped muscle there. So what I colored in is papillary muscle. They pull on those heartstrings, and they help keep the valve closed during systole. Okay, so the third thing I wrote, papillary muscle. Papillary means nipple shape. That's the structure, identify it. I colored it that green color. And what I had said about its function, they contract during systole. Systole. Did I say that's when the heart's relaxed or contracting? Yeah, so these muscle contracts while the heart is contracting. Contract during systole, they basically help keep AV valves closed. That way, blood doesn't regurgitate backwards into the atria. It's only going to go forward into the arteries. Okay, well, more on that in a second there. But anyways, so for the AV valves, in this case the tricuspid, be able to distinguish cusp, chordae tendinate from papillary. Sometimes that's kind of problematic for students. Because it's hard to find the cusp sometimes on your sheet part. And it's like, just follow the tendon up to the cusp. It's attached, and that's kind of a useful thing to do. Okay, so I think that's all for what you see inside here. You know, when blood pumps from the RV to the pulmonary artery here, this one here is actually called the pulmonary trunk. Let me color it in here. Pulmonary trunk. I'll use purple. So what I'm coloring in purple here is the pulmonary trunk. Pulmonary trunk, it's literally receiving blood from RV.
AV is arterial valve?
AV stands for atrioventricular valve. Yeah. So all you got to know is
Everything.
Yeah. All I was going to say, RV pumps blood into the pulmonary trunk. And I kind of colored it that purplish color. Here's a question to see if you're following me. Is blood at this point oxygenated or deoxygenated? It's deoxygenated. This is still before it went to the lungs. In fact, the pulmonary trunk will bifurcate into two pulmonary arteries. Bifurcate means like fork into two. Bifurcates. Into two pulmonary arteries. So here's one pulmonary artery going off this way. Okay, you can see the direction of the blood. I like the little blood flow arrows. They're really helpful for students. Here's the other one on the other side. It goes behind the superior vena cava there. Okay, you can kind of see it there. Because you got two lungs, a right lung and a left lung, and so each of those is carrying the deoxygenated blood to those lungs. Okay, so you got two pulmonary arteries. I call them in blue. And soon they go out and they get oxygenated and they return via 4 pulmonary veins. Oxygenated blood returns via 4 pulmonary veins. Now you got 2 right, 2 left. I'll use kind of red to color them in because now blood is now oxygenated, right? And they're right here. Here's 2 from the right side. There's one there. There's another one there. And the blood flow is returning to the heart, and the blood is now oxygenated. So there's the 2 on the right, here's the 2 on the left. Two on the right, 2 on the left, pulmonary veins, and they're returning blood to which chamber of the heart? To LA. Okay, so that's where we are now. So the LA, I'll kind of trace it out in red here. So on this picture, it's kind of like this. Okay, so that's, I'll put LA right here. And if you look inside the left atrium, you can even see the orifices for 4 pulmonary veins. I'll just kind of draw like little red circles here. Okay, you can see them here illustrated on the picture. All right, so we got all the way back to the left heart. Before I proceed, I want to talk about these 2 valves right there. They're called the semilunar valves. So let's note that. So note 2 semilunar valves. SL's for semilunar. So if you look how they drew one here, kind of like that. Let me pick a color here. How about this green? I like how they show it to you. It's right at the base of the pulmonary trunk and RV. So this is called the pulmonary semilunar valve, and it allows blood to flow into the pulmonary trunk from RV. So I'm going to write that down. So you got RV. It has to go through pulmonary semilunar valve. I'll just call it pulmonary SL valve. And blood goes from the RV through that valve when it's open to pulmonary trunk. Okay, and I use this light green color, the color of this pulmonary semilunar valve. The other semilunar valve is right there. It's kind of hiding. It's difficult to see. It's the aortic semilunar valve. I'll use the same colors. It's right there. I think I'll kind of just color it in here. The aortic semilunar valve will carry blood. It will receive blood from LV. It will go through the valve into the aorta. So, once again, from LV through an open aortic, SL valve to aorta. And again, I use that same green color. But there are two different valves. One is like for the pulmonary trunk, and one is for the aorta. I want to throw those in there before I get to the left ventricle. Okay, so far, I've mentioned 3 valves. There are 4. I mentioned the tricuspid, and I mentioned the 2 SL valves. So let's go back to while I was teaching. You should be able to answer this question. Where does blood go after LA? LV. Yeah, very good. All right, so I'm with it. So let's trace LV in red because it's still blue blood. So LV, it's all this area here. Okay, it's all that area here, and look how thick the ventricular wall is for the LV. It's super thick. I'll color it in solid red up the side of the wall here. And compare that thickness to how much thinner the wall of the RV is on the side. RV, if you color it in, it's, by comparison, is much thinner. And you'll see that on the sheet part. One side has to generate more pressure, but it turns out the output is equal for RV and LV. They push out the same amount of blood, but one has to generate more pressure. Okay. Now, there's a big septum right in between. How about I use orange here? When you get to this part there, that's called the apex of the heart. The opposite of apex is base, and it usually refers to all of this big area up here. Apex, base. Well, anyways, I was going to color orange all the way up the middle, from apex all the way up in between. Because that's called the interventricular septum, between the 2 ventricles. Okay, so where I colored orange, interventricular septum, just right now. All right, so we got all the way from LA to LV. However, the valve you had to go through to get from LA down to LV, that's called the bicuspid valve, and I'll still use orange again. This is another AV valve. There's one cusp right there. There's the other one. It's a bicuspid valve. You can call it a bicuspid valve, or you can call it the mitral valve, also known as mitral valve. Or you can call it left AV valve. AV stands for atrioventricular valve. Well, they all mean the same thing. I see all the terms used. Fill in the blank. That's what you could call any of those three. The term mitral valve is more a clinical term. They thought the valve resembles a miter's cap. So mitral valve, that name is still used. But anyways, be able to tell the cusp, how many are there? Two. I call it an orange. And the AV valves, again, are controlled by the chordae tendineae. I think I use this pink color. Chordae tendineae. And then the papillary muscle on the bottom there. All right, so when blood is received by the LV and it pumps it through the aortic semilunar valve, it goes into the aorta. Now the aorta, on this picture, there's different parts of the aorta I'll get to later, but the first part of the aorta is the ascending aorta. The first part of the aorta. So I'm going to color that red, trace all around here. It continues all the way on up here. Okay, so that's all ascending. It's like the first 2.5 centimeters. That's what a textbook usually would say. It will continue on as the aortic arch. Let me use a different color so you can kind of see it better. How about I use purple? Again. So the aortic arch continues on right there. It's a candy cane. It's an arch. Basically, it's a continuation of ascending aorta. They just kind of call it different things. It's very important because notice there's a ligament between the aortic arch and pulmonary trunk. We use black. It's right here. It's a connection between pulmonary trunk, aortic arch. It's called the ligamentum arteriosum. It's another remnant of fetal circulation, but note it because I'm going to have you idea it on the sheet part. Ligamentum arteriosum. You know, the aorta continues on behind the heart. It's called the descending or thoracic aorta. So you go from ascending aorta, aortic arch, to descending, or you can call it the thoracic aorta. Now it's hard to see. It kind of like ends. You can kind of see a smidge right there. I color it in there, and you can kind of see it at the bottom there. It's going behind the heart. It'll continue all the way down. It'll actually go through the diaphragm and become abdominal aorta, though. We don't have to know it until we get to digestive stuff. But anyways, another one to be aware of, descending or thoracic. I'll show you some better pictures of it later. Descending or thoracic aorta. The students kind of get annoyed by all different names for the aorta, but it's important to know. They all give different branches, and they all supply different parts of the body. And there's other branches coming out there. I'll get to those later. But I feel that's enough coloring for the heart. It's a good introduction. Yeah, any questions? You got 4 chambers. How many valves? 4. 2 semilunar, 2 atrioventricular. And there's a term called the great vessels of the heart. Because not only do you have to study the heart, you have to study the vessels that are attached to them. Superior, inferior vena cava, pulmonary trunk, aortic arch, okay, pulmonary veins. You have to know them all. And some of our hearts have blood vessels attached to them. And students kind of forget, well, oh, I have to know blood vessels for the heart chapter. Yes, you do. They're attached to them. Okay. If you want to practice, use this figure. Follow a squirt of blood through the circuit. And along the way, just name all the structures blood is passing through as it circulates through the double pump. It starts off with SVC, IVC. Blue because it's deoxygenated blood. Then where do you go? Well, number 1, right atrium. RA, I'll do it real quick. This is just kind of an overview. I already went through everything. Think about what valve do I got to go through to get from RA to RV? Tricuspid. Now what? Now I got to go from R into the RV, fill it up. And from the RV, its job is to pump blood through pulmonary SL valve. Into pulmonary trunk. It's an artery, but we call it pulmonary trunk. From there, the pulmonary arteries will take blood to pulmonary capillaries, and I'll kind of draw that like half red, half blue, to symbolize blood is picking up oxygen. So we call this pulmonary capillaries. And by the time you get back to the heart, you have to return via 4 pulmonary veins. Notice I've changed from blue to red. We've now picked up oxygen. And we're at the bottom of the figure. I'm just following the figure in case you're wondering. Right? And then pulmonary veins return blood to, I'll show you where I am in the figure, LA, left atrium. And from LA, you go through the bicuspid valve. And then from there, you go to LV. Then LV will pump blood through the aortic semilunar valve. And then from there, you're in the aorta. The arterial system will distribute blood to systemic capillaries, and I'll draw it half red, half blue, symbolizing you're dropping off oxygen. And it's the job of systemic veins that will collect blood and bring it back to the RA. Well, anyways, we went through the double loop. Okay, and it's a real easy exercise to do, and if it's not easy, keep rehearsing until it is easy, because you got it all down. That's how blood circulates. It's just following that figure. Well, to get more to back to anatomy, I showed you the heart by itself. When you get the sheep heart, appreciate that you're not getting the sheep with it. You don't have to remove it, is what I'm saying. It's been removed for you from the slaughterhouse. You know, I remove human hearts, and when I open up the chest cavity, I get pictures similar to this. What I want students to appreciate is when you remove the chest wall, you barely see the heart. Okay? It's not like you have a Valentine's box of big red heart. You don't see that. You don't see anything. I barely see a bit of the pericardium that covers it. The lungs occupy most of the space of the thoracic cavity. If you do a section through the heart, what I want you to see here is how the heart sits in the chest. Okay, so let me get one of my models over here. I just want to show you real quick. What I like about these heart stands is the heart sits on the stand as it does in your chest. And what I want you to take away is that the ventricles are in front, the atria are in back. Okay, because how we've been presenting it is like the atria are on top and the ventricles are on bottom, but that's not the case. The ventricles are in front, the atria are in back. Okay, so that's one thing I want you to know. Atria, they're posterior to the ventricles, and behind them. And look at the cross-sectional view. It's kind of like, this is the right heart, that's the left heart. The right heart is more anterior. Right heart is more anterior. When you put your hand over your heart and say the Pledge of Allegiance to the flag, we usually like put it over the left side of the chest. But really, the heart is closer to the midline. I mean, it's slightly to the left, but not completely to the left. Here's another picture. We have a model of this section. And now let me point to the 4 chambers of the heart. The 1, 2, 3, 4. 1, 2, 3, 4. Let's go through it again. If that's 1, what is it? Right atrium, right ventricle, left atrium, left ventricle. Okay, so that's kind of how the heart sits in the chest, a little kind of to the side, and right is more anterior. That's the sternum right there. Okay, and they sit between your lungs. Technically, the name of the space is the middle mediastinum. The heart is located in the middle mediastinum. Think of it as a space within the thoracic cavity. Move on. Okay, well, let's kind of cut the heart and look at the layers of the heart wall. As we saw in the previous pictures, the heart is covered with the pericardium. And this is a good analogy. Think of the pericardium as a water balloon filled with fluid. And when you stick the heart in there, which is about the size of your fist, you stick it in there, the pericardium that is intimate, touching the heart, is called the visceral layer of the serous pericardium. And the layer on the outside is the parietal pericardium, and it's filled with a fluid. Okay, so it's fluid filled. There's the 3 P's in anatomy. There's the pleura, the peritoneum, and the pericardium. So this is one of the P's. Think of the pericardium. Covers heart. Be aware of visceral pericardium. It's a very thin layer. It's difficult to remove. When you get your sheet part, it's going to appear shiny because of this smooth, serous membrane. Actually, it can be removed with great skill, and if your group does it, I'll give you a bonus point. You guys love that. So you always try.
Yep, there it is.
+1 bonus. I'll show you some pictures of students who did a good job of it so you kind of know. It's kind of like thinner than saran wrap. And if you get a big sheet up, you can kind of look right through it. It's pretty beautiful to see when it's done nicely. So anyways, that covers the heart directly. It's intimate with the heart wall. Right? If you have your own dissection tools, you're free to use them.
Kidding.
Then you have parietal. Now, in between the parietal and visceral is the pericardial cavity that is fluid-filled. The function of this pericardium, it covers the heart, but basically it keeps the heart from overfilling, okay? Because it's like containing the heart. And it's fluid-filled, it reduces friction as it's beating and moving. It's not rubbing and creating friction against things that are next to it. Prevents overfilling. Now, it can cause problems. You could have what's called a cardiac tamponade. Like, for example, in female hygiene, a tampon, the endometrium gets absorbed into it during menses. Cardiac tamponade, you're bleeding into this space, okay? And that could put pressure on the heart and cause problems. But anyways, that's a clinical side note. Just know the basics here, okay? The pericardium and the cavity is fluid-filled. A lot of people want to say the pericardial cavity contains the heart. That would be incorrect. The cavity is the fluid-filled space. So if you take a little chunk right there, in this picture what you can see is that the pericardium is attached to the great vessels superiorly and the diaphragm inferiorly. I'll get your note there. Attached to great vessels, you know, like superior vena cava, aorta, pulmonary trunk, those ones. Attached to great vessels superiorly. Diaphragm inferiorly. Oh, okay. Let me repeat that. It's worth saying. Okay, great vessels. Write this down. SVC. So that's one of them. Superior vena cava. The other one, pulmonary trunk. Third one, aorta. Yeah. So when people say great vessels, it's those three. Yeah. No problem. Well, let's go through the layers of the heart wall as illustrated right here. Let me erase my heart stuff from prior. Now, anytime I color, you're not required to do it. I'm not having you turn it in for credit. I think it helps a little bit. It's kind of a new thing I started doing. And if you remember me coloring, it helps you remember something for the exam, then I'll keep on doing it. All right, well, anyways, let's call this layers of the heart wall. And we could start with the pericardium. So let me just leave that up there before I erase it. You see how there's this fibrous part that's attached to the pulmonary trunk that I just got through saying it's attached to the great vessels? Okay, this part here, I'm coloring in purple, they call that the fibrous part of the parietal pericardium, the fibrous part. So the parietal pericardium has a fibrous part. Anything that's fibrous, it's tough. And this is the part that attaches to things. Okay. Now there's a serous part of the parietal pericardium. Let me use a different color. How about blue? It's all right here. So this is the serous part of the parietal pericardium, okay? I mean, that's the part that secretes fluid that fills the pericardial cavity. But notice that this serous part, it folds in on itself and becomes on top of the heart wall, the visceral layer. So it's going to kind of fold in and then be on top of the heart wall right here. So that is actually considered the outermost layer of the heart wall, but it's one and the same as the visceral layer of the pericardium. So I drew it up here. So this is also colored in green there. Okay, wait. When I colored those three things, pericardium. Okay, but let's start with the layers of the heart wall.
Do you need to say visceral layer of serous pericardium, or will you accept visceral?
Visceral pericardium is usually what I said. Yeah. So let's write that. That's the outermost layer, what I drew in green. Visceral pericardium. I'll draw it again, or write it again. Visceral. Cardium. Again, I colored it in green. It's also known as the epicardium because it's like one and the same. It's also the outermost layer of the heart wall. You'll see it on your sheep heart, also called epicardium. Now, most of the heart is muscle, and that's the myocardium, the muscular part, the cardiac muscle. Myocardium. I'm going to use red to color it. It's all the way from this big chunk from there all the way to there. So that's all myocardium. And then the inner membrane is the endocardium. It actually touches the blood. Color it orange here. This is endocardium. Orange, little white, just about a dark orange. Well, anyways, you can see where I'm coloring it if you can't see the color too well. This represents the endocardium, touches the blood. Innermost layer. Touches blood. It turns out because it's the innermost layer, it actually gets a lot of nutrition from the blood that's in the chambers. Okay? Anyways, I colored it that orangish color there. So know the layers, starting with pericardium, go all the way into endocardium. Move on. Let's take a look at a side view of the heart. If you kind of remove shoulder arm and look inside the thoracic cavity from the left side, they usually call it the red side because the artery is on the left. So it's called red side because they usually use red to color arteries. This is the descending or thoracic aorta. So when people say red side, well, yeah, let me erase all this. Artery's on the left, vein is on the right. Just remember that. The left side is red side. Because on that side you can view the descending or thoracic aorta. It's on the left. Descending or thoracic aorta. But on the other side, the right side is the blue side because you can view superior vena cava. SVC, superior vena cava. So that's a quick slide on that. Now I did mention the great vessels of the heart. And in terms of the veins, I have a couple of pictures here where you can see, let me label what I think you should be able to see on these unlabeled pictures. Hold on a second. Okay, let's look at just the veins here. This is a good one to look at. This shows you how all the veins and arteries are all kind of together in the thoracic cavity. So I'll use the isolation one to teach. Okay, this vessel right there, use black. This one right there, that is the subclavian vein. The one it's merging with, this one up here, that's the IJV, the internal jugular vein. It's the main vein of the neck. It runs with the carotid artery. Okay, so those two, they merge to form brachiocephalic vein. Right here. Brachiocephalic. Vein. So can you see how those two, subclavian, IJV, they're merging to form one brachiocephalic vein? Now, where I've lassoed those, is that on the right side or the left side? That's on the right side. Very good. So this is right. That's right. So this is left. This will be the, you tell me. This one. Left IJV. And then this one will be left subclavian vein. And they merge to form left brachiocephalic. Now, right and left brachiocephalic vein, this is the one on the right, they merge to form one superior vena cava, SVC. So that's kind of the blood vessels I want you to know. They're all draining down. Basically, all the blood from upper extremity, head, neck, all get drained into the SVC in that way. Okay? The left and the right are not the same. Notice how the SVC is more on the right So if you're on the left side, you got to travel a longer way to get to the right side. So left brachiocephalic vein is longer than right brachiocephalic vein. So that is the difference between left and right I want you to know. The left brachiocephalic vein is longer than right. Note these two, the azygos and hemiazygos. That system of veins drain chest wall. Azygos and hemiazygos veins drain chest wall. Turns out it's the azygos that drains directly into subclavian vein, right there. It's always hiding from students. On this model, number 52, right on the back there. So that one you got. Azygos drains right into the superior vena cava. All right. So this is, I'm just trying to mention to you how the right and left aren't the same. Which one's longer, right or left for this one? Left is longer because it's got to go from right to the left. It's got to go from the left to the right. This is more on the right side of the heart, more or less. So here's the heart and the chest cavity. The other part of anatomy I'd like you to know is that the subclavian artery and vein, they go in front and behind a muscle called the anterior scalene. The subclavian vein is in front of it. The subclavian artery is behind it. So that's a useful landmark. Write that down. So the landmark is anterior scalene. It's a neck muscle. I use it as a landmark to locate the subclavian vessels. Subclavian vein it's basically anterior to it. Subclavian artery posterior. So can you see that on this? Well, this is in the room. It's in the back there, torso. I point to the anterior scalene, and so if you see a blue vessel going in front of it, what's it going to be? Subclavian vein, subclavian artery, behind it. Okay, so that's the anatomy there. Right, did that. Well, anyways, this model, I just have some pictures of other models there. I want to move on. So when you get the sheep heart in your hand, it's been removed from the mediastinum. Appreciate everything that has to be cut to get it. Here's a picture of the empty pericardial space. There's diaphragm where the pericardium attaches to below it, and you can see how they cut away where the pericardium is attached to the great vessel superiorly. You've had to cut 4 pulmonary veins. There's the inferior vena cava, superior vena cava, aorta, pulmonary trunk, and this is what you'll get in your hands. And so it's important to understand the surfaces of the heart so that you can understand, well, you can know where to cut. So we usually present the anterior, posterior surface, and the inferior surface, also called the diaphragmatic surface, because basically it's sitting on top of the diaphragm. Okay. All right, so let me give you hints on how to tell which surface is which surface. So when you get it in your hands, one thing you could do is you could get a model and put it on your bench top next to your heart and say, okay, does this look like that? And kind of guess. And the clues to look for the anterior surface, call those surface features. anterior interventricular groove, or sulcus. Sulcus is a depression. Anterior interventricular sulcus. They contain fat and coronary vessels. Okay, anyways, if I find that, I know that I'm anterior, and I know that I'm right between the two ventricles. So let me point to it. Right there. This is the anterior surface. I see mostly this. That's the RV. So if this is my landmark, and that's the RV, what's on the other side? The LV. The other way you know, you have these Dumbo ears. These are called the auricles. Right auricle, left auricle. Look for those. Put them in the same frontal plane. Right auricle. Left auricle. The auricle describes the appearance. Auricle means ear. They look like Dumbo ears. When the heart receives blood in the atria, they kind of expand and fill. But when they're deflated, they look like Dumbo ears. Okay? Well, anyways, the right auricle is a part of the right atrium. And the left auricle is a part of the left atrium. So look for those. If you have your Dumbo ears in the same frontal plane, and you see that anterior interventricular sulcus, you're basically, that's the front. Okay. And there is kind of the anterior surface of our smaller heart model that we have in the room. Well, here's the ligamentum arteriosum, also can be seen in the front. Let me go back to the picture there. Ligamentum arteriosum. Difficult to spot, but if you know where to look, it's between the first, okay, identify. Where's that? Pulmonary trunk, aortic arch, right in between. And the student found it. This is the best one I've seen on the sheet part. I took this picture. It's right there. Aortic arch, pulmonary trunk. And it's a very significant one. Okay, usually students point to the general area where it's supposed to be, and I give credit because it's hard to find. But, if I get my phone out and take a picture of something you found, it's one of the best I've seen. And we'll see what we have next week. Okay, this is not anterior, this is posterior. And what you mostly see are the atria. So we call this is all for anterior. For posterior, I mean pretty much LARA, that's all I see. Let me see if you see it. Which one is that? The LA or the RA? I see 4 pulmonary veins draining into it. That makes that LA. I see superior, inferior vena cava draining into the RA. Okay, that's what you see there. All right. For the diaphragmatic surface, or the inferior surface, by the way, that's a hole for the stain. Okay, you don't have to identify that. Hole for the stain.
Is that going to be a trick question?
Yeah, that would be a great one. It wouldn't be a trick. You're supposed to know that's the hole for the stain. I trick you without trying to trick you, so I don't need to try. And that is hard, it's confusing. From this surface, I want you to see this sulcus. It's more or less vertical. This is the posterior interventricular sulcus. So this is the inferior view. Basically, it's the back, right? I've seen students, it's hard when you get the sheet part for the first time. You start studying the back like you think it's the front. Now, do you see the problem with that? Yeah, it's like everything's going to be misidentified. So be sure you can tell the front from the back. That's the first thing you want to get right. So this is the inferior view. Look for the posterior interventricular sulcus. you know, the posterior and the anterior interventricular sulcus, they kind of meet front to back. So if I draw a simple Valentine's heart, then we've got our 4 chambers there. It's like the anterior interventricular sulcus is in the front, but the posterior interventricular sulcus is in the back, so I'll use dotted lines. But they connect front to back. Okay. And there's coronary vessels in them. Now there's another sulcus that goes kind of around the top. And it wraps around the backside. And that's the coronary sulcus. And you can see it from this view quite well. The coronary sulcus has a very important vessel called the coronary sinus that lies in it. The sulcus contains the sinus. And the sinus is draining deoxygenated blood right to the RA. It's receiving all the blood, all the spent blood from the heart muscle itself. So it's very important. Let me point to it. Coronary sinus in the sulcus. And this is the most important, it's not the most important, it's the most difficult thing for students to identify on your sheet part. It requires a little patience on my part to wait for you to get to it. Right, see there? Right there? Right there, just remember that. It's a tough one. What I like students to do is, I like you to stick a probe from here in the right atrium and snake it through there. And I want to see your little probe on the inside of that. Okay? I think that's cool if you could do it. If you do that without any assistance from me, I'll be very impressed by your group. I won't give you another point, I'll just be impressed. You'll have to have the satisfaction, I just was impressed, that's it. Anyways, on this heart model, again, hole for the stand, okay, it's right there. Now that hole you have to know, what is that for? Inferior vena cava. Okay, but there's coronary sinus going right into it. So that if you work with the models, again, the models sit on the stand in the exact orientation it is in the body. If you open it up, you can see some internal structures. Well, let me describe this appearance here. It looks like Tillman took the muscle and took a comb and raked it. And they call that pectinate muscle inside the atrium. Now this is inside the right atrium, but it could be inside either. I want you to show me pectinate muscle. It's the internal appearance of the muscle of the atrium. That's both for the LA and the RA. Happens to be this is RA for this model. If I want to label it on the for like a lab practical, I would just kind of put it there or a sticker there. And I'd phrase the question, identify muscle. So you know I'm going for pectinate muscle. Okay. Let's move on here. Oh, okay. If it wasn't labeled, could you tell that this is the right ventricle? We kind of traced it out there as the same shape. What if I had to identify just this right here? Conus arteriosus. We got our 2 valves, tricuspid, pulmonary semilunar valve, tricuspid, pulmonary semilunar valve. Okay. So when I taught the valve for the AV valves, I said there's cusp, heartstrings, papillary muscle. There's the cusp. Then what are these things? Chordae tendineae is the full name. And these little nipple-shaped muscles, call them papillary. All right. Now look at here. This is my landmark. Anterior interventricular sulcus. Therefore, what chamber is that? left ventricle. So let's go through the four. Number 1, RA. Number 2, RV. Number 3, LA, left atrium. Number 4, left ventricle. And there's my landmark, the anterior interventricular sulcus. That should be the first thing you find when you get your sheet part in your hand. Oh, here's the view of the left heart. And we can see the LA and the LV right there. So if this is the left side of the heart, what valve is that? Bicuspid, chordae tendineae, papillary muscle. Look at the inside appearance of the ventricular wall. It has a rough appearance right here. Whether it's the whether it's the LV or the RV, it has this roughened appearance. There's a name for that. It's called trabeculae cardiae. It means crossbars of flesh. It just describes the internal appearance of ventricles. You know, it's funny, when you look at the little crossbars of flesh, there's little whitish threads that are nervous tissue fibers. They even show you here, like these little red lines that they make. And those are called Purkinje fibers. It's one of my favorite words in anatomy, Purkinje. They're whitish threads, but they're not the chordae tendineae, but they're whitish. And that's another bonus point if you can see it, because that's usually something off the reservation where it's like, it's not required, but if you can see it, I'll give you a bonus point. So if you're keeping track, how many could you get?
2.
2, okay.
I'm working on one more.
So you got the 2 there. And Purkinje fibers is cool to see if it's there in your heart. Anyways, yeah, go ahead. Oh, I got a good picture of it at the end here. Yeah.
Is the pectinate muscle more anterior than the trabecular cardiae?
It's inside the atria,
Like
on the inside.
on the inside of
And the trabecular cardiae inside both ventricles. Yeah. Now, I mentioned earlier how the aorta has different parts, and I wrote it quick on the board, but here's kind of the nice picture that teaches that. Ascending, aortic arch, descending. Remember, you can also call the descending aorta the thoracic aorta. So to be technical, they draw a line across where the ascending becomes the aortic arch. That's the sternal angle, manubrium, body of sternum, so right there. The first couple of centimeters, the first 2.5 centimeters, is ascending aorta. And what I want you to know are the branches that come off of each of these parts. All right? The branches of the ascending aorta are the right and left coronary arteries. The branches that come off the aortic arch, there's 3 of them. I'll show it to you. From right to left, it goes from right to left, coming off the aortic arch. It goes brachiocephalic trunk. These are all arteries. left common carotid, left subclavian arteries. So those three from right to left, and we'll look at pictures of those. For the descending aorta, as it descends, it's passing by all the ribs, the pairs of ribs. So there are paired posterior intercostal arteries that come off the descending aorta. Posterior intercostal arteries. So here's some pictures of those things, starting with the ascending aorta. They cut it so close to the valve, you can see the valve right there. And your sheep part may look similar. And the first two branches coming off, this one's going off to the left coronary artery, right coronary artery. Notice how the left one is very short, stops right there, and it divides into two branches. The right one gives off branches. It's called right coronary artery all the way around to the back of the heart. Here's a picture of, well, look at this picture here with the isolated aorta. This is the aortic arch. And the three branches you took note of from right to left, that's from this side to that side, brachiocephalic trunk, left common carotid going up the neck, left subclavian. So once again, brachiocephalic trunk, left common carotid, left subclavian. Again, notice that the right and the left sides are not the same. So when you study this, it's the brachiocephalic trunk that will then divide into right subclavian, right common carotid. So that is one difference you're expected to know. And the reason why you have this trunk in between is because notice how the aorta is a little bit on the left side. So if you want to send arteries to the right side, you got to send the brachiocephalic trunk first, and then it branches into carotid, subclavian. On the left side, they branch directly off of the aortic arch because they're closer to the left side. So that is one difference between left and right, tends to drive students crazy. The other thing that drives students crazy, this is called brachiocephalic trunk. It's an artery. These are called brachiocephalic veins. Okay, they're both like the brachiocephalic vein. So keep that in mind. Here's a picture of posterior intercostal arteries coming there. They're paired, they're coming off there. They look exactly like that. I've seen that on cadavers. Here's the descending or thoracic aorta from T4 to T12. We kind of use the vertebra as landmarks, as where it begins and ends. The aortic arch, because it's an arch, it's like a rainbow, it begins at T4 level and it ends at T4. The descending aorta begins T4, it runs from T4 and it goes to T12. All right, so going back to the coronary arteries, there are branches of the coronary arteries. And they're called the right coronary artery, the left coronary artery, and they each have two major branches that we expect students to know. Marginal and posterior interventricular, and then circumflex anterior interventricular. And here are the veins that I'll teach. Great, middle, small, cardiac veins, and a fourth one, the coronary sinus, which I've already mentioned. So notice how they call them coronary arteries. Coronary refers to crown. If you were to isolate and look just at the arteries, it looks like a crown. It's very unusual. Okay, well anyways, the figures that kind of teach that are like here. think this might be a good time for a quick stretch break. But I'm using all of class time today, so I'm just going to stay here. I'll give you 5 minutes.